Hi, everybody. My name is Braden, and I'm going to be continuing our discussion on framework today. Today, we're going to be diving into the hip and spine, and go ahead and get started. So, starting with the hip. The hip is a pretty complex joint. It's a ball and socket joint, and what that means, it can move through three planes of motion. So we got hip flexion, extension, abduction, adduction, and then internal and external rotation. So just with that movement potential, it plays a large role in our overall movement as well as our posture. And see some common dysfunctions that arise in the hip are caused by a lack of movement. So this lack of movement can cause tightness and in some cases lead to mobilization. And also previous injury and just repeated patterns and poor posture can cause further injuries in that hip complex. Just as we kind of talked about, again, our body's going to take that path of least resistance. So if that least resistance causes us to have some poor posture, we're going to repeat that movement pattern. And that movement pattern can lead to that chronic pain, which we're trying to avoid. So now talking about myofascial release with the hip, great for the hip flexor. So that muscle that's right on the anterior part of our hip, right inside that hip, as well as our IT band. We got that big tendon right kind of from our hip almost down to our knee, right along the outside of our thigh. So myofascial release, really great for that surrounding musculature in the hip. But what we're going to be talking about a little bit more today is mobility of the hip. So with that, it's extremely important to work through full range motion of the hip because, like I mentioned before, that ball and socket joint has a great amount of movement potential. So we want to make sure that we're maximizing that movement potential and moving through those three different planes of motion through our hip. And this is just so crucial because our hip mobility is used and needed in every day. Think we're walking upstairs, having to step onto a larger box or platform, whatever you may have. We're using our hips a lot in everyday life. So we want to make sure that they can move properly. So we have having that quality of life really just as simply as by having mobility through our hips can really be monumental there. So with that, we're going to be talking deeper into mobility exercises for the hip, but we'll be talking about that at the end after we get to the spine. So the spine, huge importance, provides our body's just structure and support. And in a lot of ways, it's just the foundation of our human movement system. A lot of things kind of like are connected and are outlets from our spine. So we're going to place a real big importance on our spine. Common dysfunctions that can lead to some spinal problems are caused by lack of movement, previous chronic injury, and then poor posture. So we're going to focus on lack of movement and poor posture. A lot of people see the spine as kind of like a stiff joint, but it's very important to get proper movement throughout the spine, as well as having good posture, making sure our spine is in proper alignment. So that way that it does move, we're moving back into a nice neutral spine, as shown in this picture right here. And in terms of myofascial release, it's great for the surrounding musculature of the spine. We just want to make sure that as we're doing myofascial release, that we're avoiding rolling, putting pressure directly onto our spinal cord. But great for the muscles, in our low, mid, and upper back. Just again, staying off that spinal cord is key. So mobility of the spine. So when we talk about mobility of the spine, we'll talk a lot about rotation. And that's just because one of the large motions that our spine does move in, but it does move in other planes other than just rotation. So the primary importance of our spine is to stabilize, but mobility, again, crucial. Our spine is broken up into three parts, as we saw in that previous slide. So our thoracic spine, right, the section of our spine right in the middle of our back is very mobile, whereas the lumbar or low spine or cervical spine right in our upper back, those will be more stable. So we're getting a lot of rotation through the middle of our spine. And as well, on top of that rotation, so we have rotation, we also have protraction and retraction. with our spine is also a great a movement we want to work through. And with these movements, what that is doing is just really helping aid in our spinal health. So it really takes pressure off the intervertebral discs in our spine. Just have a little like padding between those each individual vertebrae. It takes a lot of pressure off those discs as we're rotating, as we're getting more mobility through our spine. So they're not just stacked on top of each other at all points of time. So now I'll dive into some exercises for the spine and some exercises for the hip. Go. Awesome. So first movement that we're going to talk about, starting with the hip. We start with the hip. There are movements that are going to be interconnected because the hip and spine are tend to be interconnected in a lot of ways. So some of these may cross over. There are some exercises that you can do for your hip that are going to aid in like low back health and can help your spine. But all these will be beneficial. So first one we got focusing on the hip will be opening and closing the gate. What I'll be doing is I'll be starting standing upright, and what I'm going to bring my knee in and up, and then I'll keeping that knee up, bringing it out and back. So this part we're calling opening the gate, bringing that knee up, externally rotating through my hip, and then bringing it back down. So I'll go open the gate and also have closing the gate. Closing the gate, I'm basically just doing the reverse of that action, and I'm internally rotating at my hip. So I'm bringing that foot back, up, and around out in front. Awesome. So that was opening and closing the gate. Next we'll get into is our quadruped hip rotation. So this one's a little bit more difficult. What we're doing is getting in a quadruped position. So I'll be all on all fours, my hands and knees. And how I'm going to do this is I'm going to kick. I'll start with my right leg, kick that leg straight out, and then as I want to hold my foot up in this position, and then I'll bring it out to the side, touch my foot down, and then from the side here, I'm going to bring my foot back up and then back around into that starting position. So I'll go ahead and show it again. I'm going out while along that plane of motion, going out to the side, touching my foot to my side, lifting up again, and bringing it around. So here is exercise here. Want to make sure that I'm keeping that heel up, so make sure I'm maximizing that range of motion through my hip. I also want to pay attention to my spinal alignment as well. I don't want to be arching too much in my spine here. Want to have a nice neutral back or neutral spine there. Awesome. So last movement with the hip, I got from a shin block position. So with that, my left leg is tucked out in front of me. My right leg is tucked out behind me, both at about a 90-degree angle at my knee. And what we're doing, I'm moving the back leg. I'll be internally and externally rotating at my hip. So first, I'll be externally rotating. I want to pick my foot up off the ground, and then externally rotate, touch my heel down towards the ground, kind of just about parallel from where my other foot is. And then I'll be picking my foot up and bringing it back into that starting position. So with this, I want to focus on keeping my chest and my body upright as much as possible, but I can lean to the side if I just need to get a little more mobility through that hip. It's okay. But I really want to focus on keeping my foot up as well as I'm lifting it up. And then as I'm bringing it back, keeping that foot off the ground. Again, we're just trying to maximize that range of motion through my hip as much as possible. Awesome. So from there, we're going to get into more spinal movements now. My first one is a side lying thoracic spine rotation. So I'll be laying on my back to start. I'll kick my right leg over the left, and I can go ahead and grab right outside of my right knee. I'll bring my right arm out in front of me, just like right in front of my chest, leg straight out. And then what I'll do is I'll bring that right arm directly up and behind me, and I'm trying to touch that right shoulder down toward the ground. So I'm just getting as much range of motion as I can get while keeping this, using my hand to keep this knee down. And I'm rotating through my spine. Again, use this hand to anchor this knee down, bringing that arm straight up and around, and I'm rotating through my spine. Awesome. All right, next movement I have are thoracic glides. So this is where we're going to be talking more about that retraction and protraction of my spine. So I'm going to do this. I'm going to be sitting down, leaning back slightly, and I'll go ahead and grab either my right or left knee. And then my arms will stay straight, but I want to be moving through my spine. So I'm kind of thinking of pushing my back through my shoulder blades, and then puffing my chest out, and just moving right through that middle section of my spine. So first, go back, and then coming through my chest, extending as much as I can. Back, then coming through my chest, extending as much as I can. It's a little bit of a funky movement, but what we're really trying to focus on is just moving at my spine as opposed to like pulling my arms in towards myself. Really just focus on having that little bit of movement through my spine. It could feel like just a little bit of movement. That's completely fine. Just want to, again, make sure we're focusing on the movement at our spine rather than moving at other parts of our body. And we got one more exercise for the spine. This is going to be going out of a quadruped position again. We'll be threading, dynamic threading the needle. So for my quadruped position, on all fours, I'll take my right arm, thread it underneath my left arm. Go ahead and put that arm on the ground. And then I'll bring it up and around. And then I'm getting that rotation through my spine again. So show the other side. I'm threading my arm through, getting that rotation, and then coming up around. Get rotation to the opposite direction. And then return to the center. So with that, I'm just making sure I'm getting as much rotation through my arm and up and around as much as possible, while again paying attention to my body, making sure that I have a nice neutral spine as I'm working through those movements. But that is all I got for you today. I appreciate you for listening, and I hope this was helpful. Thanks. Bye.